Dear students, today we will discuss a little bit about environmental pathology because it's one of the components in your curriculum. Therefore, let us go together and discuss, see how we can do it. So, we have the learning task, and at the end of this presentation or session, you as student are expected to be able to do the following. First of all, define environmental diseases, explain air pollution, explain industrial and agricultural exposure, and also explain the effect of tobacco product use. So those are things that you have to understand, and typically you have to have them in your mind so that you can concretely say that you have studied environmental pathology. So by definition, environmental diseases can originate from occupational exposure. Here we are speaking of those activities that we are doing. Maybe you are a farmer or you are an industry person. Those are things that can expose you. So pollutant ambient air, we are talking of airs which are different air which are available in air. Chemical taken from body through the lungs, GIT. For several reasons, maybe you are expiring polluted air, or from noxious physical agents that can come into contact with your body. Some of the chemicals, they can just come in contact with your body, and finally they can cause diseases. So there are several causes of environmental diseases. It's also referred to the disorder caused by exposure to chemicals or physical agent in the ambient, workplace, or personal environments. So all those environment around us, again, they can cause risk of diseases, mostly from chemical, physical agents, workplace, personal environments. All those can cause problems. So let us start with air pollution. Air pollution is the most common thing currently with the global warming and with industrialization, because at the end all those things they are producing the pollutant. So air is the most of the time loaded with potential causes of disease. The agent from the air, like microorganisms, like now we are speaking of COVID-19, is also available even in air if you're in close contact with someone, containing foods and water. Chemicals, particulate pollutant found in air are common causes of diseases. There are actually two types of air pollutions. There is outdoor air pollution and indoor air pollution, as we'll see them later on our talk. So let us start with outdoor air pollution. The ambient air in industrialized nations, here we are talking of Europe and America, is contained with gaseous and particulate pollutants which are coming from those industries. So pollutant may cause trivial irritation to the upper respiratory pathway or airway, and this can cause acute or chronic injury to the lung, some causation of the lung cancer. So there are a lot of pollutants from these industries which are produced, and most of us we inhale through our airway system. And finally, this one can cause chronic irritations of the lung, the mucosa, and finally they can end up causing diseases in mostly the respiratory system. The 6 common outdoor air pollutions or pollutants, we have the ozone, we are going to see it, the sulfur dioxide, the carbon monoxide, nitrogen dioxide, lead, and particulate matters. These are small tiny objects. So ozone is one of the most pervasive air pollutants. It's the gas formed by sunlight-driven reaction. So there is a reaction which is caused by sunlight, involving gases like nitrogen oxide, which are released mostly by automobile. When we are driving the cars, we are releasing gases together with the nitrogen, together with oxide and fine particulate. They can come together. Fine particulate here, they are pollutant from maybe we are talking of those who are doing constructions, road construction. You get some small particulate. They can come together, form a family of smoke, or from smoke and fog come together. It is toxic. Stems from its participation in chemical reaction that generate radicals that injure our lining. So the major effect here that we are talking is this one can generate free radicals. And if you have free radicals, these free radicals actually they cause reaction to your cells, and some of them they can cause mutation of your cell. They can cause inflammation of your cell, and finally they can cause diseases. We have sulfur dioxide. particles and acid aerosols. Sulfur dioxide particles and acid aerosols are emitted by coal or oil-fired power plants and the industrial process burning these fuels. So particles appear to be the main cause of morbidity and death. So particles less than 10 micrometer in diameter are particularly harmful since they can be held and they can be carried in the airstream all over the way to the alveolar. So when they go there, you remember your body has the immune system that is fighting against any foreign objective. So phagocytosed by macrophage, those things will be phagocytosed by macrophage, neutrophil will go there. They'll cause releasing of inflammatory reactions, which at last they can cause you cough, produce mucus, and this continuous reaction may cause problem in your respiratory system. The large particles are removed actually by the nostrils in your nose, and you expel them by coughing, by sneezing. But if they're very tiny, they go down to the alveolar and they can cause problems. We have carbon monoxide. The carbon monoxide is a non-irritating, colorless, tasteless, and odorless gas. So therefore, you can have it. You will be gaining it in your body. You will be inhaling it, but you cannot even notice. It is produced by incomplete oxidation of carbonaceous material. The source include mostly the automotive engines, even the boda, the cars, industry using fossil fuel, home oil burners like we are burning kerosene and all those they can produce. But again, carbon monoxide can be produced by cigarette smoking. So the low level often found in ambient air, normally normal air, the ambient air, normal air that we are inspiring, they can have this low level of carbon monoxide and may contribute to the impaired respiratory function. So most of the time it's not that much life-threatening, but prolonged exposure they can cause problem. We have carbon monoxide. Carbon monoxide, this one, however, person working in confined environment whereby there is no oxygen interactions, exposure to this gas may cause problem, especially for those people who are working in tunnel or working yourself in a room which is closed. Carbon monoxide is included here as an air pollutant, but it's also an important cause of accidental suicidal death because some people die from carbon monoxide either by locking themselves in a room and finally finding themselves having problems with the inspiration, and they die from this. Why? Carbon monoxide is systemically affectant that kills by binding to the hemoglobin. You know, hemoglobin are responsible for carrying your carbon dioxide, distributing it all over the body for respiration to take place, for glucose to be broken down to release energy. But when you are having carbon monoxide in your body, what happens is your hemoglobin will bind more strongly with carbon monoxide and therefore leave no space for oxygen. This may cause a very big problem because now you cannot carry out the oxygen, the respiration process will cease, and many other metabolic processes in the body will cease. Therefore, carbon monoxide will result to a compound called the carbon hemoglobin, which is incapable of carrying oxygen. Hypoxia lead to the central nervous system depressions, and you know the end results of hypoxia. No supply of oxygen, most of the metabolic activity will stop. So those were kind of outdoor pollutants, and here we are having indoor air pollutions. The commonest pollutants in this category are tobacco smoke. This is very important for you to understand as a student. Then we have carbon monoxide. We are having nitrogen dioxide, asbestos, wood smoke, formaldehyde, bioaerosol, the radons. So we'll see one after another here. The other indoor air pollutants, we have wood smoke, and this is common in Africa, as you know that we are using wood to cook, and we are using mostly wood and for cooking, especially in Central Zone and Arusha, Singida, Dodoma, Tabora, and many other places whereby people are using wood to cook. So these are containing various oxide of nitrogen and carbon particulates. So this predisposes the exposed person to the lung infection. So if you are getting those smoke, especially if you're cooking firewood, whereby they are not that dry, therefore they're giving a lot of smoke, you can get airway, lung infections caused by this chronic irritation from those smokes. Radon, these are the Mostly they are radioactive gas derived from uranium. It's widely present in soil. So these are emitted. They are continuously emitted. So exposure to them may cause problem as well. So low level chronic exposure to in the home does not increase the lung cancer risk. At least for that one you should be aware. But for those people who are engaging themselves in uranium mining, so these are at risk again to get this problem because prolonged exposure with high dose of radon they may cause risky for the lung cancer. We have bioaerosol. This may contain pathogen microorganisms, agents that are those that cause Legionellas. Here we are talking of disease. Legionellas they can save in system like we call like cooling system. Mostly we use in our places kiyoyozi say. So they can stay there for a long time, but they are bioaerosol because as you inspire that air may have Legionellas inside. But viral pneumonia as well, common colds as well. These are allergen derived from pet danger, dust mites maybe, and fungal mold, which can cause rhinitis. Your nose is like having rhinitis, eye irritation, and some people it can even go further and provoke asthma. So the adverse effect of air pollutants on lung depend upon few variables that includes the following. So when you say maybe someone has a lung cancer or someone has a lung problems caused by air pollutions, there are things that we have to consider them so that we know exactly this might be the cause. First of all, longer duration of exposure. You really need some time to be exposed to that pollutants for you to get lung diseases. It's not one day thing that you are going to the smoking today then you're getting it. Not. It needs a prolonged exposure. But again, the dose of exposure. What are you exposed? Maybe you get in every day, but very small amount of smoke you get it. It might take a long time for you to really your body to change and cause a particular problem that we have tried to mention. But apart from that, impaired ability of the host to clear the inhaled particles. Here we are speaking of children's who the respiratory system is not that matured and they don't have a very good ability to expire out, to cough, to sneeze, to remove those particulates that have entered. But again, for those people who are smokers, of which they don't, the ciliars have been distracted, the mucus system have been distracted by cigarette smoking. This all causes problem because alas they cannot clear their airway and they can have these particular problems. But again, the particulates, the size of particles, the smaller particles, they are more bad when compared to the large particles because the smaller the particle, they go deep down to the alveolus and when they sit there, they are very difficult to be removed. Therefore, this one can cause problems. And as you know, when they sit there, our immune system will recognize them as a foreign substance and finally go fight, release inflammatory reactions. And this one, the major cause of chronic irritation, inflammations, and formation of things which are caused by reaction that are happening with the macrophage cleaning. Yeah. So the smaller the particle, the more danger the particle. The larger the particle can easily be removed by sneezing, coughing, and with a clear airway. So we are having industrial and agriculture exposure as well. Here we are speaking of organic solvent, we are speaking of polycyclic hydrocarbons, we are speaking of organochlorines, diones, and PCBs. We are having biophenol and BPA, exposure to vinyl chloride, inhalation, mineral dust. Let us see them. So when I'm speaking of organic solvent, some such as chloroform, carbon tetrachloride are found in degreasing and dry cleaning agents. Here, for people who are using these dry cleaning agents, mostly in Africa we don't use them, but in town most people now are adapting having these dry cleaner reagents, and they have this organic solvent. So acute exposure to high level of vapors from this agent, they can cause dizziness. When you're exposed to these agents continuously, acutely, you can have dizziness, confusion, sometimes get CNS depression, and even coma. So these are dangerous agents. The low level have toxicity of the liver and kidney, they can cause toxic to the liver. Occupational exposure for rubber workers to benzene and 1,3 butadienes increases the risk of leukemia. Actually, benzene, when you see benzene, there is high risk of leukemia, which is cancer of the blood. Polycyclic hydrocarbons, these are released during combustion of coal and gas, makaa mawe and gas. So particularly by high temperature used steel foundries, and also present in tars and salt. When I'm speaking of tar here, speaking of lami in Swahili, salt. So polycyclic hydrocarbons are among the most potent carcinogen. When you say carcinogen, they can easily cause cancer. They can convert our cell and become cancerous cells. And industrial exposure have been implicated in causation of lung and bladder cancers. Therefore, if someone is exposed highly with coal and gas, and they're working there for the particular time, they may end up having lung and bladder cancer. Because why bladder cancer? Because those particulates they are collected, they will be deposited by the kidney to the bladder. Prolonged exposure to those chemicals, as they are removed by the bladder, by the kidney, and they stored to the bladder, they can cause the bladder to change and become cancerous. But again, the prolonged exposure through the airway, they can cause lung cancer. So Port identifies soot as the cause of scrotal cancer. The soot in chimney, they can cause the scrotal cancer. This was identified a long time ago. The soot it's like moshi kama moshi, either a sigara au a makaa au anything that can cause the problem. We have organochloride and halogenated organic compound. Importantly, organochloride used in pesticide, kwenye dawa za kuulia wadudu, like in farms, shambani kule. They have a lot of DDT. Again, this one, they can cause neurological toxicity, your brain, because if they are the drugs or they are pesticide used to kill microorganisms, you have to remember that the mechanism of action for them to kill microorganisms is in acting central nervous system of those microorganisms. Therefore, you are having this almost same receptors that they can be endangered by this particular problem. So non-pesticide organochloride include polychlorinated biphenyls, PCB, and dioxins. Dioxin and PCB can cause skin disorders such as folliculitis. Your skin become inflamed, acne. They can be formed acne. You can see the acne and dermatosis, which is the form of a kind of irritation in your skin and inflamed skin. It can be accompanied by abnormality in central nervous system as well. We have other industrial exposure. We are speaking of bisophenol, BPA. This is used in synthesis of polycarbon food and water container, and food bottles and cans. Those one that stores water, food cans, mostly a plastic kind of instrument or equipment, vessels. So DPV has long been known as potential endocrine disruptor. So this affects the endocrine system, and exposure to vinyl chloride is used in synthesis of polyvinyl resin was found to cause angiosarcoma of the liver, which is mostly a very rare tumor. Inhalation of mineral dust, those causes chronic and non-neoplastic lung disease called pneumoconiosis. These are diseases of the lungs whereby your lung doesn't become cancerous, but the alveolar spaces they collapse because of this reaction, and this problem may cause someone to be dependent in oxygen. And we have several number of people who have been admitted at KCMC with this particular problem, and they end up leaving the hospital for a while because they cannot afford having oxygen at their home, and therefore they stay in hospital to be saved. It's very costful. And that's why it's important for people to be educated, especially those who are involving themselves in working in mineral industry. So inhalation of mineral dust, the most common pneumoconiosis are caused by exposure to mineral dust. So here, mineral dust that we are saying that they cause pneumoconiosis, as I said, the lung diseases. We have the coal dust. This in mining of hard coal caused by coal workers' pneumoconiosis. So those people who are working coal industries, they are most likely exposed to coal dust, and therefore they are more at risk of getting pneumoconiosis. This is an occupational disease as well. Silica, this is sandblasting and stone cutting. those people who are working in places like road constructions, they are blasting the sand, stone cutting. Those who are working in making pebbles. So all those people are at risk of getting silica, and then they can go to silicosis. And the other is asbestos. This in mining, fabrication, and insulation workers. Those are working in fabrication, in mining industry. They can cause asbestosis. These are diseases affecting the lungs, especially the alveolus, in such a way that they cannot carry the oxygen, or they cannot do their job of exchanging the oxygen with carbon dioxide back to the body. We have beryllium in mining fabrication caused by berylosis. This causes the berylosis. These again are the component. The final thing that I want to speak to you today is about tobacco smoking. I think this is very common problem, especially in developed world. But again, even in Tanzania, the problem is expanding mostly to young people, because they with development, people feel like smoking, engaging in alcohol is more of being civilized, but it's not true. Tobacco poses a lot of problems, because on its own, smokes contain more than 2,000 compounds which are dangerous in our body. So to mention few, we have nicotine. Nicotine is responsible for addiction. The feeling of going to smoke again and again and again, it is caused by nicotine. So nicotine addiction, this causes problem, especially when you're exposed to it, you feel like going back. And again, what causes diseases from this particular tobacco smoking is the desire to go back. It causes exposure, strong exposure to some chemicals which I've mentioned, more than 2,000 chemicals. Here we are speaking of tar, we are speaking of polycyclic aromatic hydrocarbon, we are speaking of nitrosamine, we are speaking of aromatic amines. These are strongly carcinogen. When I say strongly carcinogen, they can easily change our cells, especially the lung cells, to become cancerous. And that's why more than 90% of people with cancer, if you ask them their history, they'll tell you they have been exposed to cigarette smoking for some days back. So nicotine is an alcohol present in tobacco. It is not a direct cause of tobacco-related disease, but it's highly addictive. Therefore, how do we implicate it with cancer? Because the more you're exposed to nicotine, you feel like going back and back again. Then this one, because this chemical binds in your brain receptor and release catecholamine, a hormone that makes you feelings like you're in heaven. So this chemical, which causes you to relax your mind, feeling like you are somewhere else, it causes you to repeat doing it. And there are acute problem that can be seen, especially like heart rate increases, the blood pressure increases, the cardiac contractility will increase, and the output. Therefore, all these ones, for someone who is new, may feel like there's things that make you like more strong, feeling like, yeah, I'm well. Because if you're having heart rate increase, the blood pressure is up, and your heart is contracting faster and faster. You feel like, oh, I'm in good terms now, I can move with my things, I'm good to do something. But actually, the carcinogen components are very stronger than what we are feeling for a particular time. So, tobacco is the most common exogenous cause of human cancer, being responsible for 90% of the lung cancer. The main culprit of the lung cancer is cigarettes. When you're speaking of lung cancer, you are more likely, if you find in multiple choice, the major cause of lung cancer in men and female is smoking. But smokeless tobacco is in its various forms. Now, there are other type of tobacco, like there are people who are chewing tobacco. They are also harmful because they are the one responsible for oral cancer. Most of oral cancers, they are caused by tobacco. You can see places like around Manyara, places whereby people are chewing a lot of tobacco. They are coming in with a lot of mouth cancers, especially the buccal, because of strong irritation from the chemical which are present in that particular cigarette product or smokeless product. Not only does the use of tobacco produce a personal risk, but also passive smoking, inhalation of environment, especially we call second-hand smoker children. The children whereby they are exposed to the smoker a father who is smoker, they are more at risk of developing cancer when compared to other children. They are called second hand. A wife who is married to a man who is smoking, a man who is married to a wife who is smoking, also poses the same risk almost with someone who is a real smoker. So the most common disease caused by cigarette smoking involve the lung include emphysema. There is a chronic bronchitis whereby someone produces mucus, coughing continuously for some time. But the most dangerous thing is again a lung cancer. Chronic bronchitis and emphysema are one of the chronic obstructive pulmonary disease which are most common for smokers. So what are the effects of tobacco smoking to respiratory system? Argentine smoker have direct irritant effect on the tracheobronchial mucosas. So the mucosa is affected, producing inflammatory and the mucus production. That's why people who are smoking find them coughing. They cannot easily expel what they are coughing. Cigarette smoke also causes the recruitment of leukocytes. These are white blood cells in the blood in the lungs, and they have a fighting cell, the immunological cell, increase the local excess production and subsequent injury to the lung tissue leading to emphysema. Component of cigarette smoke, particularly polycyclic hydrocarbon and aerosols, are important. They are potent carcinogens. They can cause cancer in animal and they probably involved in causation of lung cancer in human. That's from the history. So the other effect of tobacco smoking, I think when I was speaking of cardiovascular system last time, we spoke about atherosclerosis and arteriosclerosis. But atherosclerosis is very common, and the main idea of this tobacco is having complication with regard to what we call causing injury in endothelial membrane of the blood vessels. Therefore, this causes mechanism probably related to the several factors, including increasing platelet aggregations because of those small injury, decreasing myocardial oxygen supply because of lung disease coupled with hypoxia related to carbon dioxide, cigarette smoking, accompanied with increased oxygen demand. This all they can cause fibrillation in your heart and that particular problems. So what are the cancers related to the tobacco smoking? Tobacco smoke contribute development of cancer of oral cavity, the oral cavity cancers, the esophagus, very common, the pancreas cancer, and bladder. Why bladder? The bladder because most of the toxic product or carcinogen, they enter the bloodstream and they are removed through the system. The combination of tobacco chewing, smoking, alcohol consumption has multipliable effect on risk of oral, laryngeal, and esophageal cancer. Effect of tobacco in terms of pregnancy. For pregnant women who are smokers, they are at risk of spontaneous abortion. Mimba inaondoka. Also, they can have risk of preterm birth before 37 weeks. They can give birth, which is dangerous. Again, they have intrauterine growth restriction. The baby in the womb is born but is very tiny, smaller than 2.5, which is recommended weight at least. So those are things that you have to remember. For passive smoking inhalation, exposure to the environmental tobacco smoking, passive smoking inhalation is also associated with detrimental effect. It is associated with the risk of lung cancer. Children living in household in adult who smokes have increased the frequency of respiratory illness and asthma. But passive smoking inhalation in a smoker can be estimated by measuring blood level of nicotine, metabolic nicotine. So what are the key points here? The most common air pollutant are ozones. They said combination of nitrogen oxide with other particulates, oxygen. Carbon monoxide binds to hemoglobin and prevent oxygen transport. This is dangerous because this is why people die. Polycyclic hydrocarbon has been implicated with causation of lung and bladder cancer. And when we say DDT, the one that we said in pesticides, also they are responsible for neurological toxicity. Inhalation of mineral dust causes chronic non-plastic lung diseases. Cigarette smoking also causes death, mostly from cardiovascular diseases, as I said, atherosclerosis, and virus cancers, especially the respiratory system, the oral mucosa, buccal, and things like that. Yeah, so these are your tasks. Have you review the questions here below, and make sure that you are aware and you have understood the topic clearly, and wish you all the best as you are preparing yourself for your next exam. Thank you.